Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the comprehensive evaluation and successful treatment of chronic thyroid disorders. And in this ongoing video series, I've been talking about different things that can cause your thyroid issue, and we talked about the importance of the immune system and what can trigger the immune system to go haywire. So what we're going to do is we're going to talk a little bit more about those triggers today. And some of those triggers can be underlying infections that no doctors have found, like a virus, a bacteria, yeast, fungal issue, parasites. Those things can cause the immune system to go haywire. Also, something else that's very important is food allergies. It can be any food allergy, but probably the most common food allergy that we find, especially with thyroid patients, because most of those thyroid patients are autoimmune, is gluten. So I want to spend a lot of time talking about gluten today because it's so important. We find it extremely common in patients that come to our office. Now, gluten is a protein that comes from wheat. Gluten is also found in other grains that have a similar composition, like rye and barley. Now, oats, strictly speaking, don't have gluten in them, but also all oats in the United States are processed in plants that also process wheat, so we're going to get trace contamination. However, if you go to someplace online where you get organic oats that are certified to not be processed in a gluten facility, then oats would be okay. Now, the reason gluten can become a problem, and there's a lot of news about this all the time. It seems like more and more people are having trouble with it. And the reason is that since the 1940s, wheat has been genetically modified. And also gluten also is chemically altered so that the food manufacturers have an easier time making things out of it. And so that's good for them, but it's not necessarily good for you. So what happens is that your immune system can start reacting to gluten, and then it'll go after the gluten and thinks it's a foreign substance. It'll start attacking, creating inflammation, and then because other body parts look similar to the gluten molecule, like especially your thyroid gland, it'll start attacking your thyroid. So it could be attacking your thyroid now. Also, eventually, if it's not handled, it can also attack other body parts like your joints, your brain. So it's definitely not a good thing to have. So it's very important that this be checked for you to find out if you have any issues with gluten. Now, what can happen is that some patients will say, hey, well, I've had some tests done and it came back negative, and it may be that you don't have a problem with it, but what we find is that a lot of times when gluten is tested for, only maybe like one test is run, and so we get a lot of false negatives. In other words, the patient test comes back and says, okay, it's not a problem, but as a result of not doing enough tests, the patient actually really does have a gluten problem, but that particular lab test didn't show it. So it's very important that you have a complete, very comprehensive gluten evaluation and have the proper test run to find out if you actually have the problem or not. Because if you do have it and you're not addressing it, unfortunately, it's probably damaging your thyroid gland, and if not handled, it can cause a lot more problems. So in our office, we do a very comprehensive test. We check all the parameters to find out if you do have it or don't. If you have it, we won't miss it, and if you need to address it, we have a lot of good resources to help you get off gluten if that's what needs to happen. So the tests that we do will not only show if you have a sensitivity, but will also show if you have a genetic issue where, because of your particular genetics in your family tree, you just don't have the proper genes to actually digest gluten, and that is what we call celiac. Now, sometimes that shows up. Sensitivities are much more common, and if you have a sensitivity, by getting you off gluten for a period of time, getting your immune system a chance to rest, and also addressing other metabolic issues, what can happen is that over time, it's possible that you could actually reintroduce gluten into your diet, and you could do fine with it. So it just kind of depends what the test shows. So if you would like to have these tests run to find out if you have this problem, and also have a more comprehensive evaluation to determine all the reasons why you have your problem and why it's not getting better, then give our office a call at 425-821-1101.